You pioneered the non-surgical nose job. So let's talk a little bit about that, because I think in all the years I've been doing this and all of the providers I've had on, I don't think we've ever really discussed that specifically. Who is it good for? What can you accomplish? Who is it not good for?
Non-surgical nose job or non-surgical rhinoplasty is by far my favorite procedure that I do. It's very rewarding. People just are so happy with their results because it's something where I can be very, very precise about the effect I want to achieve, and it saves people an operation. So for so long, people have understood that the only way to change the contour of the nose is through surgery. Now, this procedure is here where in 5 minutes, you can really significantly change the contour of the nose, and in a way that's so precise and so specific that in some cases, with everybody, but with a lot of people, it's more precise and better than surgery. And so again, everything has every tool and every kind of procedure that's a good procedure has its uses. And so for some people, surgery is certainly the way to go. And I have a series of people who I would refer to who I know do a really good job with rhinoplasty. And then they refer non-surgical patients to me because, maybe they've already had surgery and they just want correction of a small thing, and it has to be very, very precise. And it's something that is very difficult to do surgically, and it's something that's very easy to do non-surgically. And so they'll refer to me, and we do that. I think, so for patients who need reduction in their nose, that's not a patient for non-surgical rhinoplasty. Now, there's a caveat to that. For people who have a bump or people who have a tip that's coming down, they look at their nose and they think they have a big nose. Sometimes they don't actually have a big nose. It's just that when you have a bump or you have a tip that's coming down, it looks like your nose looks bigger because it stands out from the rest of your face, right? So it attracts more attention from the eye because it's irregular. It's not the contour that the eye expects. And so therefore it looks bigger. So the funny thing is, in those kinds of patients, I add to their nose, right? And I make it look smaller. Because it's straighter, because it's more of what the eye expects to see, it blends into the rest of the face and it looks smaller. This is the kind of thing that gets me really excited about the things that we do, right? It is that we, in doing these non-surgical procedures, in doing facial sculpting, we are directing the gaze of the observer to the areas that we want the observer to see and away from the areas that we don't want the observer to see, right? And so we are guiding the gaze. And so it's a little bit of illusions. We work with illusion, we work with perception. It's not necessarily obvious, the effect that we're trying to achieve. And this is a great example of when you add to someone's nose, but you're making it look smaller because it's straighter and it blends into the rest of the face. I think that's kind of cool.
And then you probably see their eyes first.
And then you see their eyes first. No, but that's absolutely right. Because the nose, you have a bump in the nose, or you have a nose that's kind of maybe off center. And then when you look at their face, you see their nose. You make it straighter. You make it, straight on the profile, straight on the front. Now you're looking at their eyes. And that is always the most beautiful part of someone's face. When somebody hasn't had surgery, a lot of times it's somebody with a bump or somebody with a tip that's coming down that wants to make a nose straighter on the profile. But then the other bigger actually component of people that come in to see me at this point are people who have already had surgery. And then they've had a rhinoplasty. The result was maybe a good result, but then over the years, scarring happens. And the nose is it's a feature of the face that over time after rhinoplasty can change contour in a way that doesn't look quite as natural anymore as it did before. And so they come in to see me and they want to maybe correct small contour irregularities, small kind of, asymmetries, that kind of thing. Again, it's something that's very, very precise, and it saves them an operation, especially a revision operation for rhinoplasty is complicated. It's expensive. It's, there's more risk involved. There's downtime. And so if you can do that in 5 minutes, it's great.
Yeah. So you mentioned risk. There are risks with the non-surgical rhinoplasty, right? So we don't want the listeners to just run and go to any med spa or Groupon and be getting filler in their nose, because it can be a higher risk area, right? So what are some of the things that people should look out for?
If you're thinking about non-surgical rhinoplasty, you have to go to somebody who's very experienced injector and a very experienced injector specifically with non-surgical rhinoplasty. In general, filler injections in the face are very, very safe procedures, but there's always some risk to anything that you do. So of all the areas of the face, the nose is the highest risk. And so when you go to somebody for non-surgical rhinoplasty, you want to make sure that this is a person who's experienced with injectables, experienced with non-surgical rhinoplasty, who understands how to prevent complications, who understands how to manage complications. And that kind of information is not so easy to come by, but it's I think experience is the key, right? And so not price. Of all the procedures that you do, this is the one that you don't want to choose someone based on price. You can have a complication where it doesn't look quite like how you want it to look, where maybe the top is a little bit thick or it's just not quite right. And that's kind of an easy complication to manage, because that's the nice thing about hyaluronic acid fillers, is you can dissolve them. But there's other complications that are more serious. So you can have issues with blood flow to the tissues, ischemia, necrosis, and extremely, extremely rarely, there have been cases of blindness reported. And when those cases of blindness are reported, they're reported in this area, so glabella and nose. I think that a lot of those cases are cases that have happened in Asia and have happened with practitioners who shouldn't be injecting, like in nail salons or hair salons and things like that. But it's there. That risk, very, very, very small, but it exists. And so you want to minimize it as much as possible. I take a ton of precautions to make sure that it never happens. It's never happened in my practice. Over 20 years, do it daily, every day, several times a day, because I take a lot of precautions. And so I think that's important to keep in mind.
And that happens from filler going into a vein or an artery?
We think it happens because filler gets into an artery and goes backwards into the ophthalmic circulation. We're not quite positive as to the exact mechanism of why blindness happens. This is our kind of thinking of how it happens. It may be that it has something to do with vascular malformation that this person in particular has that make them more susceptible to something like this happening. We're not sure. And we're investigating it, I'm investigating with my colleagues quite a bit. We talk about it and try to figure this out. All over the world, there's a lot of attention being paid to, why does this happen? What is the mechanism? What can we do about it? So, but that's what we're thinking.